related to Fairburn, and what about the attachment of the bad object that was in character pathology, and he worked a lot with children as well as adults, so he worked with the kinds of kids that Fairburn saw running back to their abusive homes, abusive mothers, being addicted to the bad object. And, but he gave us more palatable language for certain of Fairburn's terms, like the libidinal ego in Fairburn and the anti-libidinal ego, which was related to a split, and Fairburn talking about in terms of schizoid phenomena, the core split in the psyche with early trauma, as opposed to Klein's just, or split that would lead into integration in the healthy person, as along with a split that was there in pathology that she wrote about. But for Fairburn, it was all about the pathological side of people. And he talked, so before we get to dialectic, we have to talk about how, in their focus on helping people who had such primal trauma, both Fairburn and Jeffrey were talking about this split psychic structure of the libidinal ego and anti-libidinal ego, but Jeffrey gave us the much more palatable terms, dependent self and anti-dependent self. And because we were all talking about the self by this time. Then in his case reports, like in The Bad Object, where he talks about a kid that he talked about so many times, mentioned so many times in his discussions and talks at the Institute. And he always talks about in relation to why he got interested in Zen and Tai Chi and the whole thing about states of being and beyond and without memory and desire being the moment. He would talk about this kid that would throw this ball back and forth with him. And it was almost his signature case. I think he said it so many times about why he had to learn how to have a Zen Buddhistic kind of experience to do this work with this kid. And he said, we threw this ball back and forth, and I was passing out, it was like going on, and I was a very schizoid kid. And so the empty core, the kid was empty, but we move from the empty core into the bad object. The bad object is progression when you're schizoid, and you have to get to the borderline level before, which also Thomas Ogden shows me to me. It's very schizoid cases. We make great progress when we get to the bad object in the borderline level. So this is what Jeffrey was showing. He was sitting there going back with the ball, and he was having this schizoid experience, passing out in tiredness, as we can all start to do when we're this schizoid person, because there's no affect. There's no interaction, there's no feeling of the other, and so you start to get sleepy. So he was passing out, and he was like thinking, how am I going to deal with this? And when he started reading about Zen, and so he tried to then be in his Zen experience with the kid with the ball, but he realized in terms of the dialectic that it was like he was experiencing both the kid with the mother who didn't pay attention to him, and it was totally distracted and self-preoccupied, the schizoid mother, the schizoid kid. He was the kid, and he was also the mother that the kid felt wasn't giving him any attention, and the kid would get very angry, wake up, wake up, wake up, while he's falling asleep. And so the kid started getting angry. He said, oh, this progress, he wants me to wake up, he's demanding something from me. He's got some sense of agency, he's alive there. So he really started to get in. Then the kids started becoming more persecutory and being the bad object and telling him to do a million sit-ups and handstand, whatever it was, like, all kinds of stuff physically, until his endurance level was, and he said, I can't do it anymore. All right, so but what he got to through this was that not only was the kid the persecutor and the persecutory demanding anti-libidinal ego, now called the anti-dependent self, and the kid was the the one who was starving and attacked and persecuted from within, turning it against him. But he also, of course, again, felt both sides. And it's interesting that Otto Kernberg had written about how in the borderline you could go back and forth from being the self part and the object part and that split. But Jeffrey added, yeah, but you can also feel like you're both at the same time. So that's what he was feeling, like he was both at the same time. So he was feeling that with this kid, and the kid was, being sadistic, do all handstands, not enough, I don't care if you're tired, do more. And he then realized that the kid was reaching a level where he was exhausting his destructiveness. In Winnicott's terms, there was object survival. He was surviving the bad object attacks being turned against him that were inside of the patient, the internal world, and in the internal pathological world, as I would say, with an incorporated bad object as opposed to an internalized one, which implies more digestion, psychic digestion, but really just fully swallowed, incorporated, and then spit up. And that's why it's psychic bulimia, as well as physical bulimia at times. So he was being tortured, spit up, and all this, but in this, he saw the kid was exhausting his level of destructiveness, and one day he had him blindfolded, and the kid was starting to throw things around, tear things. He didn't know what the hell was going on because he was blindfolded. But when he took off the blindfold, he saw that even though the kid tore up a few empty pieces of a paper and threw things around, the kid didn't actually destroy anything. So he thought this was really meaningful, that this kid had some intuitive sense of containing his destructiveness and letting Jeffrey suffer, but not be killed off or destroyed in any significant way that would truly injure him. So, and that's an intuitive genius of the destructiveness in these patients that Thomas Ogden also talked about. And I talk about in terms of the object survival of therapists leading into the Winnicott's sense of the height of destructiveness of the patient, moving then into a capacity through the rage being contained to become symbolized into the surrender to a mourning of the primal object loss and through developmental mourning. So there's a dialectic there, but for Jeffrey it was, he was really elated by this. I mean, he's talked about this experience with this kid and the fact that he was able to have enough of a Zen attitude to be in the moment and be present enough that this kid came out of the schizoid position and the empty core to move into the bad object and then to move into object survival where he could, the developmental process was really moving along, where he could survive as the therapist within the height of the aggression of the early pre-edically traumatized patient that had such raw persecutory and sadistic aggression. So I think he carried this kid with him, and there was always a dialectic of he and this kid inside of him too, if we want to talk about dialectics. There were other dialectics as well. There, one thing that his wife also said to me that during Memorial Day on the memorial was that she wanted to learn Argentine tango. That she heard from Jeffrey about his seeing me do tango at the conferences, and he came back and he was talking about all the time. He had said to me, I really get it about tango, Susan. I really get about tango. It's about the intersubjective, it's object relations, it's the essence of object relations. Now, Will Nobuchi, who's now an emeritus scholar at Adelphi University, is talking about that lead and follow dialectic in tango in terms of sub-symbols and code theory, that there's a actually built-in dialectic there in lead and follow tango that's not in words, but it's there organized. So it gives that internal world, intersubjective dialectic through the tango experience. So he said over and over to me, I really get that tango, Susan. And that was something we also shared together very much. So his wife said at the memorial, I want to learn tango now. And that would be a way of preserving him for her. So these are all ways we shared our thinking, our feeling, and our dialectic. And of course, we shared a lot about our patients together. And through the years, our lunches through those 20 years, and then our communing at conferences, being on the panels together, and his workshops that he did every year, and my coming up to have dialogues with him. So these are all the ways we have the dialectics, and I'm sure I will carry Jeffrey to London with me when I speak about the Klein-Winnicott dialectic. And we're going to continue our Jeffrey Seinfeld Memorial Lectures, and we'll be talking about this. Okay, the next one. So thank you very much.
Okay, we have one topic left, which is spirituality and mindfulness. But we decided to confuse everybody. We figured it's what you need on a Friday morning. So I have a name tag for Jeffrey Rubin. I'm actually Jeffrey Lewis, but Jeffrey Rubin we thought was going to present on this topic. And Dr. Rozentsvit was going to be the moderator. So I think she's going to be Jeffrey Rubin for now. Okay. And I'll take your name tag. I'll be Dr. Rozentsvit, okay, and the moderator. This is, even though we have very little time to prepare for this, so I'm going to have to ask Ina to introduce herself. I don't have a bio on her, but I know her very well. I could probably do it off the top of my head, but I'm going to let Ina to introduce herself and to also do a impromptu talk on spirituality.
Very important. Thank you. So I am Ina Rozentsvit. I'm a neurologist, born first neurologist and neurorehabilitation specialist, and then born again as a psychoanalyst, and and never looked back. So I don't feel an authority on spirituality or mindfulness because that's not my thing. It is actually Jeffrey Rubin's thing because he is a Zen practitioner. He is a founder of meditative psychotherapy. He's written books on that. He does workshops on that. He practices that. And he was supposed to be here, but the choice was whether just forfeit this kind of piece and just go into discussion, or for somebody to talk about at least 10 minutes about spirituality and mindfulness, because it meant so much for Jeff at the end of his life, especially. And I know that he developed the curriculum for spirituality and social work, a program, the postgraduate program, that he started, and the first month, he died after first few sessions. I had the recordings of the sessions given to me as a present by the students that taped it. You cannot really make sense. Jeff was just talking, just thinking aloud, just making references to different things. So I cannot just repeat what actually he meant by this. But why I thought I feel a little bit entitled to speak on his behalf, on behalf of this legacy of spirituality, is because on the last gathering, when we had 20th anniversary of our institute, and we were honoring Jeff as, and he was very happy, and he was very on a high note. And he said, "Are you coming to my course on mindfulness? I'm starting it in January." I said, "When is the course?" It's like 8 o'clock in the morning on whatever days. And I said, "I don't know how I can do 8 o'clock. It's really to come from Queens. can we talk about it? He's like, no, you gotta come. I said, I gotta come, you want me to participate? He said, no, I want you to be there. I want you to tell me that, what am I doing is right. And I said, I will tell you what you're doing is right. I was like in my mind, it's like, what did I do? That he would say. He's like, I'm doing now your thing. This is your thing. And I said, how is it my thing? He's like, mindfulness is all your thing. So now I was like ruminating on that, and then he passed away, and I never got to hear him talking, and I couldn't kind of forgive myself. So I decided that was a transformative experience for me, very spiritual transformative experience. I decided that if I want to meet somebody, if I want to participate with somebody, if I want to get together and discuss something, I will not put it off for any time, because it might be no time left. So that's why I feel a little bit entitled to say a couple of things, not too much here. So in this short session of the panel, we will honor the spirit of Jeffrey Seinfeld, professor, therapist, scholar, who looked honestly at the difficulties of human being confront, as he embodied in everyday spirituality a passionate, authentic, and benevolent attitude in his life and work. So that little sign, big sign, the Japanese sign for mindfulness, and it's actually a sign that embodies heart and mind understanding. So it's a heart and mind. That's what mindfulness is. Mindfulness includes integration. So the pyramid is the three kind of elephants are intention, attention, and attitude. Those are three main aspects of mindfulness. William James said, the greatest discovery of our generation is that human beings can alter their lives by altering their attitudes of mind. As you think, so shall you be. Dalai Lama said, kindness is my religion. So what is included in mindfulness? Discovering patience, understanding acceptance, seeing afresh, finding trust, letting go, understanding mindfulness as heartfulness, letting go through forgiveness, avoiding quick fix solutions, overcoming perfectionism, finding out from failure. This is what Jeff Seinfeld embodied. All these points, all these bullet points were what he was about, especially finding out from failure. If you read his books, he would describe the worst case scenario case. He wouldn't put all these beautiful cases where you become this transformative and great psychoanalyst. He would describe the worst case scenario where he didn't do well, where he thought he didn't do well. And that's learning from failure, finding out from failure. That was something that many of us need to learn. I thought that this is like, Jeff was a great storyteller. That would go into many legacies, like, Robinson's legacy of cultural artifacts. He would describe any hardcore psychoanalytic concept that you wouldn't get like right away through telling a story, telling some anecdote. It was like, like Thurburn came up with this, all these like schizoid things, because he lived far away from people, so he had the chance, so he was putting it in this kind concept, not like judgmental concept. So when you identify with some schizoidness, you wouldn't feel bad about being schizoid, because people feel judged if they see some, kind of element, whether borderline element or schizoid element or narcissistic element in their character, and somebody is talking in a judgmental way, we feel bad, so we want to defend ourselves. But he was talking about it as, this is normal, this is okay. And so I wanted to bring this little anecdote that you probably, everybody saw it or heard it, or, in different variations, that sometimes it says 6 blind people, sometimes people say 3 blind people, but this anecdote is called 3 rope or wall. describing an elephant. So 6 blind people were asked to determine what the elephant looks like. So one felt the trunk and said that the elephant was like the branches of a tree. One felt the tail and said that the elephant was like a rope. Another felt the ear and said that the elephant felt like a fan. The one who felt the belly thought that the elephant felt like a wall. And the one who felt the tusk said that the elephant was like a solid pipe. So this is the moral of this thing is, you begin to understand how other people can be restricted by their views because that is all they know. They're just feeling one part of the elephant. So what Jeff Seinfeld was kind also and was mindful of, that sometimes, in an argument, he wouldn't just, yes, he would like to have this intellectual ping pong, but it was very kind ping pong. He never would let you win, but he would engage you in the continuous conversation. He would understand that you see things from your point of view, and it was okay. So this is like a moral to this little story. Now those are little things like mindful or mindful. Mindful of things is not what mindfulness is. It's actually letting go of things. That's what mindfulness is. Also, what is mindfulness and spirituality related to mindfulness is doing and being. So it's being versus doing. Being when your inner sense of awareness, allowing acceptance, peace, stillness, and silence, which is ever present underneath the doing. And doing is more likely to be restless, dissatisfied, conceptual, focused on outer world, avoiding negative experiences, and goal-oriented. So as we see from that little drawing, that the mindfulness is actually feeding this social competence. Although we say mindfulness is letting go of things from inside your head, letting go of thoughts, it's kind of very internal experience, so you would think it's very kind of narcissistic in the psychoanalytic language experience, but actually it feeds in social competence because it provides the self-regulation, emotional, cognitive, behavioral flexibility, values clarification, and exposure. And this is very much we are lacking now in our discussions in the world, because everybody has an opinion and you don't want to hear another person's opinion. But if you are mindful about yourself, about your pluses and minuses, about your blacks and whites, then you will be mindful of others having the same. So it's not you're right or the other person is right. The truth is somewhere else. It's my truth, it's your truth, and that's the truth. So now here is a little, joke, and I put a little doggy. Like I have a doggy, so I like doggies. So mindful, full of things that the person wants, or mindful that have nothing, no things, is just reflection of the internal experience. Now, of course, I'm a neurologist, so I need to bring at least one slide so it's everything, all the spirituality and mindfulness are rooted in our neurobiological mechanism. So it's not a construct that is separate from us and we invent it and it's a nice place to go to. Like I went into mindfulness class. No, it is something that's going on in our brain, in our mind, and if we teach our brain to reach those places that are responsible for those connections, then we will be more mindful of ourselves and of others. Buddha is quoted as saying, "The secret of health for both mind and body is not to mourn for the past, worry about the future, or anticipate troubles, but to live in the present moment wisely and earnestly. The journey of mindfulness is to discover how to live this way." And this is Mike Groper, Dr. Mike Groper, who came here to do a workshop just before Jeff passed away. He contributed, we have a little, I don't know if we will have time today, but he contributed those two little photographs of Jeff and him being little children in New Jersey, where they grew up. So Jeff is on the left, and Mike Roper is on the right. And here he wrote a very nice tribute. I have it there printed out, so if we don't have time to run it in a film, you can read it. Okay. And then here are all Jeff's photographs, and that's it for my presentation. And just 1 minute. I just wanted people to see. It's beautiful. Seinfeld ballet, we call it.
That was the case I was talking about, throwing the ball.
He told it 100 times.
Yes. Signature case.
And the mom who was bike riding while he was doing the work. He was
His
his
son,
son, the mom who was
Jeff's
bike
book.
riding. She just said, I want to go bike riding.
Right.
Okay. All right.
Thank you, Amy. We have about